Hi, ladies and gentlemen. I do hope we're all doing well today. Today, I will talking to us about what we call restless leg syndrome. I've seen a couple of cases in the clinic and thought it would be worth talking about it. In case you're new to the channel, it's Brain Gists. This is a channel where people get informed about the brain, the nerves, the muscles, and all of the disorders of a nervous system, all the essential things that you need to know that has to do with your health. So welcome. And if you like the content, of course, I invite you to subscribe, share, and also leave your comments behind. And of course, don't forget to turn on your notification so that you don't miss any of the videos I'll be releasing in the future. And of course, you can also check all of the logs behind all the videos I've made in the past so you can benefit from them. So today, I want to talk about restless leg syndrome. It's something I see every now and then, I'll say. So it's a very fascinating condition. So there are some people who have this sense of pain or numbness or tingling or crawling sensation in their legs when they are at rest, sitting down to watch a movie, or more commonly when they are settling down to sleep in the night. At this moment of quietness when nothing is going on, then they start to feel uncomfortable in their legs. That's the commonest symptom. And I think the cardinal thing that we look for in the clinic is we ask, how do you relieve these symptoms? And we realize that these individuals will usually say something like, when they move around, it feels better. And oftentimes it gets in the way of them falling asleep. So they can't fall asleep easily at night. As soon as they lie on bed trying to catch or fall asleep, then they start feeling uncomfortable in their legs. Some of them have to either shake the leg, move the leg, or just do something with the leg or move around the house. And then that gives them some sense of relief. So it can be very frustrating. I've got patients, for example, who go to bed at about midnight and they're unable to fall asleep until about 3 a.m. or so, or 2 a.m. because of a persistent, discomfort in their legs as they lay down in the night. So it's worse usually in the evenings or at night. Some people are sitting down doing other things, tasks. They're just not able to do anything unless they stand up, walk around to feel better. So this is what restless leg is about. And typically it tends to start that way. And then over time, you can start to crawl into the day as well, not just being limited to the night. So what causes restless leg syndrome? So it's a syndrome, meaning that there are many, it's not a complete diagnosis on its own. There are potential factors that can lead to such symptoms happening or such a syndrome happening. So I like to conceptualize it this way, that we've got about 3 or 4 main categories of reasons why people can have restless leg syndrome. That's my own way of approaching it. I believe different physicians who deal with these conditions, neurologists, general physicians, and other specialists might have, psychiatrists or sleep specialists might have their own approach to it, but I like to categorize it into 3, and that helps me explain to my patients when I'm beginning to look for the causes, and that also helps me to have like an organized approach. So the first category is what I call a systemic problem. So a systemic problem, for example, maybe iron levels are low, either absolutely low or relatively low. I know this confuses some physicians. For example, somebody has got restless leg syndrome and they do the basic iron profile and it looks normal, and they wonder. So what we talk about in restless leg syndrome is, of course, absolute iron deficiency is important, but occasionally individuals have normal looking iron profile, but then the recommendation for those with restless leg is much higher than what is considered normal. So we look at what we call transferrin saturation and want to see how well saturated the individual is. So the target is a bit higher. So it's not about absolute iron deficiency, but a relative iron deficiency. So we think the brain is starved of iron. That's the prevailing hypothesis in restless leg syndrome. So other potential systemic causes include things like inadequate levels of a thyroid hormone or low levels of folic acid, and some also check for B12 levels or vitamin D levels. All of it can potentially contribute to restless leg syndrome, and also those who've got kidney problems that can cause restless leg syndrome. And of course, we must not forget pregnancy. So it's one of the things that can happen in pregnancy, either because iron levels are dropping because of a higher need in pregnancy, or some other vitamin levels are going down. So pregnancy is one of the causes as well of restless leg syndrome. So these are the systemic causes in my view. And that's where I approach my patients anyways. And then the second category of causes is neurologic problems. So if such individuals have got neurologic problems, that can also cause restless leg syndrome. So if I've excluded the systemic problems, of course, iron tops the list, either absolute or relative deficiency of iron. And I go to the neurologic problems. Neurologic problems such as peripheral nerve disease. If such individuals have got disease of the nerves, that can cause restless leg syndrome. So we tend to test for that clinically, or sometimes if the clinical signs are suggestive, we might do electrodiagnostic testing with nerve conduction tests to look for nerve disease. And other neurological problems that can cause restless legs syndrome include Parkinson's disease and other neurological problems. So that's the second category. And the third category is psychological causes, so or psychiatric causes. So it's not uncommon for those who've got a high level of anxiety or anxiety disorders to come with restless leg syndrome and perhaps depression as well. So all of these are things that we also screen for. Just very recently encountered a young man who's got restless leg syndrome, and I think the prevailing or the predominant cause in him is a very high level of anxiety. So we look at all of these things. And then the fourth category is of unknown cause. So we've looked at all the categories and we still haven't found a cause for it, and we say this is probably restless leg syndrome of unknown cause. So in such individuals, I usually would want to try them on iron. We really want to see the transferrin saturation. If they're short of 45%, and there's a room to give them some iron therapy, and it tends to help improve things. So that's all I thought I could share with you today. So I hope you've learned something about restless leg syndrome. If you fit that category, of course, you would need to see your physician to start your evaluation and help you with treatments. There are very good treatments for restless leg syndrome, either trying to address the underlying cause or giving you symptomatic treatment. So there are treatments that can help relieve restless leg syndrome as a symptom, and there are of course treatments that are targeted at the underlying causes if one is found. So I do hope you benefited today, and if you did, don't forget to subscribe and turn on your notifications, share, and then leave your comments behind. Thank you for watching today, and I'll see you in my next video. Bye for now, and continue to stay safe.